When COVID-19 began hitting us early this year, shutting down most of our country, it also had a major impact on mandatory and on elective surgeries.
That's absolutely right, Rennie. And a lot of the people impacted, well, those were battling something other than the coronavirus, making organ donation now more important than ever. The coronavirus didn't just shut down businesses and schools and put a major strain on the medical field. It brought organ transplants to a halt due to concerns over the unknown.
The heart recipient, the lung recipient, the kidneys, the liver, whatever it might be, they all need ventilators. And there was a shortage of ventilators. And even in areas that weren't touched by COVID yet, there was an anticipated shortage. So what they defined as elective, where for other people, it's really a requirement. They really need that lung. It's available. We don't know if it's COVID. We can't afford to give up the ventilators, so they shut the entire system down.
And all this did was spiral even more questions.
There was a concern about putting, people on the same plane, going from one hospital to another hospital.
Questions over infecting one another and inability to test quickly, so they started assessing all their resources to see where they could help most.
We can help fly plasma because they were testing for plasma, so we started flying plasma to the Mayo Clinic. We started repatriating people. There were people who were stuck, elderly people who couldn't get onto an aircraft. They were stuck in Florida. They were stuck in Texas. They couldn't get back home. They were stuck alone. They were terrified to go on a commercial flight, so we started bringing them back.
Do you think we lost any lives because they couldn't get the transplant they needed?
I have no doubt there were people who needed transplants who couldn't get it.
The good news, the organ industry has started back up again and is at around 40 to 50%.
The benefit that we have right now is we can test COVID patients immediately.
And Paraflight leads corporate, medical, and charity flights and missions all across the country. They specialize in organ transplants. So, we've been talking during all of this over the last, 6-7 months, when we are remembering all those fighting on the front lines. Let's not forget these heroes that are in the sky. So, Rennie, you said earlier it's as simple as checking that box and saying that you want to donate organs. So we've thought about it before. If you still haven't done it, please do so because it is so very important. And, I was talking with him. He said he is really confident that we'll get back to 100%.
Okay. That organ donation is a very big deal for us here at 5 on Your Side because of Ann Allred, who had to have a kidney transplant. So we understand it fully, and it's very passionate in all of our lives as far as leading people to do stuff like that because one person can save quite a few lives with their donations. So, and plus you can do tissue and eyes and things like that. So you can really change a lot of lives.
Yeah, and as he said, don't be afraid to do so. I mean, there were some, unfortunately, that had to be declined because they didn't have the ability to do the testing like they do now. But now he said they're testing like within a minute and 3 minutes and 5 minutes.